Hi, everybody. So in the next 12 minutes, I will show you the results of a study called the Opportunities and Challenges of Active Immunotherapy in Dogs with B-cell lymphoma. And this was a 5-year experience in 2 veterinary oncology centers. Pet dogs most often spontaneously develop B-cell lymphoma, for which survival without treatment is measured in weeks or months. CHOP-based chemotherapy represents the cornerstone for treatment across all disease stages. Unfortunately, the majority of dogs will eventually relapse and develop chemoresistance. Therefore, cure is only rarely achieved. In oncology, immunotherapy is established as a powerful way to treat cancer. Therapeutic vaccines have the ability to generate cytotoxic T lymphocytes that reject cancer cells and memory cells that prevent relapse. Active immunotherapy, consisting of hydroxylapatite ceramic powder and heat shock proteins purified from the dog's tumors, has shown promising results in dogs with DLBCL and indolent B-cell lymphoma. This study was prospectively conceived, and clinical data on the efficacy and toxicity of treatments were retrospectively analyzed. The inclusion criteria were established a priori, and all dogs were treated contemporaneously. So the aims of this study were, first, to compare efficacy and safety of chemotherapy alone versus chemoimmunotherapy in dogs with multicentric B-cell lymphoma of various histotypes, and second, to identify the best candidates for vaccine administration. Medical records were reviewed for every client-owned canine patient with previously untreated multicentric B-cell lymphoma that presented to 2 oncology referral centers between 2013 and 2018. To be included in the analysis, dogs had to undergo a complete initial staging workup and, if possible, removal of a peripheral lymph node to obtain a histopathological diagnosis based on the WHO criteria and material for the vaccine generation. Information regarding treatment and outcome had to be available and complete. Decisions regarding treatment were based on each clinician's and owner's preference. Therefore, treatment was not randomized. Dogs receiving chemoimmunotherapy were treated with a CHOP-based chemotherapeutic protocol having a dose intensity of 12, plus 8 intradermal injections of an autologous vaccine. Dogs receiving chemo only were treated with one of 2 CHOP-based protocols having a dose intensity of 16.8 and 16.9 respectively. Therefore, these 2 protocols were considered identical and analyzed as a whole. At each treatment session, dogs underwent physical examination plus-minus cytology to assess response, whereas 2 weeks after treatment, all dogs underwent restaging by repeating all analyses that gave an abnormal result at the initial presentation, plus minimal residual disease monitoring based on flow cytometry on lymph node, peripheral blood, and bone marrow. Dogs were followed up monthly during the first year and every other month thereafter. In the case of relapse, rescue treatments were offered. The primary endpoints were time to progression, lymphoma-specific survival, and 1, 2, and 3-year survival rates. These were evaluated in the whole population and then by stratifying dogs according to potential prognostic variables to select the best candidates for chemoimmunotherapy, including sex, age, weight, PCV, platelets, LDH, calcium, substage, peripheral blood and bone marrow infiltration, extranodal site involvement, and pre-treatment with steroids. The secondary endpoint was safety, and all adverse events were graded according to VCOG. The total population consisted of 300 dogs. 82% underwent lymphadenectomy, whereas in 18% the diagnosis was obtained by FNA and flow cytometry. All dogs were completely staged and none was lost to follow-up. So when looking at all cases, the median time to progression was 147 days for dogs receiving chemo only and 244 days for vaccinated dogs. The lymphoma-specific survival was 220 days for dogs receiving chemo only and 401 days for vaccinated dogs, and these differences were significant. In the next minutes, I will talk about the DLBCL and marginal zone lymphoma cases, as these represented the most commonly diagnosed histotypes. We had 148 dogs with DLBCL. 62% of them had stage 5 disease at presentation, and 1/3 received steroids before being referred. 32% were treated with chemo only, whereas 68% received chemoimmunotherapy. There was a good balance between treatment arms regarding demographic features and outcome variables, including the number of rescue protocols. The median time to progression was 98 days for dogs receiving chemo only and 250 days for vaccinated dogs. Lymphoma-specific survival was 165 days for dogs receiving chemo only and 413 days for vaccinated dogs. These differences were significant. The 1-year survival rate was 51% for vaccinated dogs and 20% for dogs receiving chemo only. The 2-year survival rate was 19% for vaccinated dogs and 13% for dogs receiving chemo only, whereas the 3-year survival rate was 10% for vaccinated dogs and 8% for dogs receiving chemo only. So it is clear that the 3-year survival rate remained largely unsatisfactory, and the best advantage was seen in the short and medium term period. When looking specifically at vaccinated dogs, the best candidates to receive chemoimmunotherapy were those with a high serum LDH, stage 5 disease, substage A disease, and not previously treated with steroids. If all 4 of these risk factors were present, then dogs had the greatest advantage from chemoimmunotherapy. Whereas if only 2 to 3 risk factors were present, there was still a significantly better outcome. However, the survival advantage was reduced. 49 dogs had marginal zone lymphoma, and the greatest majority had stage 5 disease at presentation. Again, 1/3 of dogs received steroids before being referred. Almost 50% of dogs received chemo, and the other half received chemoimmunotherapy. Again, there was a good balance between treatment arms regarding all demographic features and outcome variables, including the number of rescue protocols. The median time to progression was 147 days for dogs receiving chemo and 227 days for vaccinated dogs. Lymphoma-specific survival was 254 days for dogs receiving chemo and 399 dogs for vaccinated dogs. The 1-year survival rate was 55% for vaccinated dogs and 30% for dogs receiving chemo. The 2-year survival rate was 28% for vaccinated dogs and 16% for dogs receiving chemo, whereas the 3-year survival rate was 10% in each group. Again, the greatest advantage was seen in the short and medium term period. So when looking at vaccinated dogs, again, the best candidates to receive chemoimmunotherapy were those dogs with a high serum LDH at presentation, stage 5 disease, substage A disease, and not previously treated with steroids. If 3 to 4 of these risk factors were present, there was a significant survival advantage of chemoimmunotherapy. Both treatments, so chemo only versus chemoimmunotherapy, were well tolerated, with no significant difference among groups regarding grade and frequency of adverse events. This is the largest study per number of dogs treated with the same product for a specific disease, and this study confirms the efficacy and the good safety profile of chemoimmunotherapy. In the case of the LBCL and marginal zone lymphoma, chemoimmunotherapy confers a survival benefit in the majority of cases. However, dogs that benefited the most were those with negative prognostic factors, including stage 5 disease and a high serum LDH. This is probably due to the fact that dogs with negative prognostic factors are more prone to develop chemoresistance, whereas chemoimmunotherapy can provide long-term protection against cancer due to the immune memory, thereby overcoming the honeymoon effect that is provided in the short term by chemo only. Dogs that benefited the most were those with no systemic symptoms, and this may be due to the fact that symptomatic dogs have a lower immunity that leads to suboptimal response to chemoimmunotherapy. Last, dogs that benefited the most were those not previously treated with steroids, because specific immune responses may be abrogated by pretreatment steroids. So to conclude, we have shown a survival benefit of the addition of active immunotherapy to chemo in dogs with B-cell lymphoma. And there is currently ongoing research that is aimed at taking into account the differences in the immune microenvironment between different lymphoma histotypes to find the best treatment for each individual patient. So thank you very much. And now we have some questions here. So one of you is asking whether in the case of relapse, would you imagine to add immunotherapy on a CHOP relapse protocol? So we don't have the data at this moment. This would be interesting. We don't know whether chemotherapy will reduce actually the capacity of the immune system to respond. So we should definitely try this. From our very preliminary data, it looks like it doesn't make the difference. So it's too soon to have a conclusion on this, but at this time we cannot suggest to use immunotherapy in a rescue setting. What about maintaining immunotherapy on a longer period with a different rhythm? Yes, this may probably further improve the outcome. Again, we don't know yet because we have only treated dogs with 8 injections of the vaccine, but this is for sure something that we would like to explore in the future. Why do you think the vaccine loses efficacy in the long-term period, and what could be done to improve this? Probably the answer is the question that was asked before. So maybe we should keep treating dogs with the vaccine to see whether we could maintain a good immune response in these dogs. Probably, maybe 8 vaccines are not enough to maintain immunity on the long term. So this is something that we will explore in the future. Any possibility to add immune system stimulators? Like what? Like which one? Yeah, I mean, this is all, these questions are all unanswered. We could definitely look into that. We don't know yet. And I think there is room for this in the future to try to further improve these results by, yeah, adding anything that could really booster the immune system. So I think that if there are no further questions, that was it. And finally, it was good. It worked fine. Thank you very much for your time. And I will keep you posted. Ciao.